At UC Irvine, we care deeply about your health, and that means your physical health, your emotional health, your spiritual well-being. We also care about the health of your family and the health of our community at large. It's so easy living in the age of society that we do to dismiss somebody with dementia, to dismiss somebody who might be toward end of life. And that's the worst thing we can possibly do. Helping everybody be their best is really why we're here. One thing that we're aiming to do is to make sure that any physician who graduates from UCI, be they a medical student, a resident, or a fellow, is superb at communicating with older adults.
The program in medical education for the Latino community has helped me structure my passions, my goals, and my dreams with faculty and staff. It's professionally developed me all the way through to my 4th year right now. The Prime LC program is the only one in the United States that actually trains medical students in serving the Latino community. For me, that's where I've come from, and that's where I have to serve, and I have to give myself to the Latino community as a medical student and as a future physician. When I graduate from UC Irvine, my goal in life is to go back and serve the neediest and poorest communities, to serve the communities where I came from. Every life is precious, and my professors remind me about that every day.
Each cancer patient wants to be cancer-free, and Dr. John Butler helped me achieve that goal. I was so blessed because Dr. Kobayashi performed an immediate reconstruction that was so beautifully done, so the cosmetic result is actually ideal. We would have driven any distance to come to UC Irvine. That was my only and best choice. I'm so glad I did. I encourage any patient who's afflicted with a disease or a medical illness to come to UC Irvine, seek out medical help so they too can restore their health.
As director of the Gavin Herbert Eye Institute, I can tell you that all of our faculty every day are committed to giving the very best eye care and protecting and preserving the vision of every one of our patients. We all know how vulnerable we feel if we have any medical issues. So that's really where I start from. How would I want to be treated? Good patient care is to do the very best you can in every sense, and that means helping the patient technically with the highest level of skill, knowing what opportunities are available therapeutically to help the patient, but also taking care of the patient as a whole. And that is one of the things that we strive to achieve with every patient.
In any conversation that I have with people, I always bring up my story and the fact that if it were not for UC Irvine Medical Center, and if it were not for Dr. Dolich, that I would not be alive today.
How I felt after Dr. Dolich saved Stephanie's life was elated. I was happy, I was crying, I was just, to know that she can be around to be Brian's mom was just a joy.
UC Irvine Medical Center is a place of healing. It's a place where miracles happen. It's a place where people are dedicated to saving the lives of people and giving them the best medical treatment available.
It's not just about caring for the wounds, but it's truly about taking the entire patient into consideration, to heal not only their wounds, but to allow them to really move on through life and to become stronger, more courageous, and confident. Every day, my team and patients inspire me, and our goal is not to have patients that leave our unit just survive. We want them to get back into the world and thrive. I'm proud to be part of the University of California Irvine Medical Center and the UC Irvine Regional Burn Team. I'm proud of the care we provide every day, compassionate, empathetic, cutting edge to our patients and their families on a daily basis.